The first speaker is Dr. Richard Bebb, right here on my right. Dr. Bebb is a physician and clinical associate professor of endocrinology and metabolism at UBC. He is an expert involved in the area of hormone replacement for men, and he was a senior research fellow at the University of Washington and UBC, and serves on staff at St. Paul's Hospital as well as with the Men's Health Initiative. Dr. Bebb.
Thanks, Wayne. My talk was supposed to be geared towards a younger demographic than we talked to in the past in these forums, and in so doing, the talk's a little bit sort of an overlap between a cookbook on recipe on how to cheat in professional sports. So with that in mind, I want to just be very clear, I'm not advocating using performance-enhancing substance for that reason, but I want you to educate you on what these hormones do and what their mechanism of action is. So here's the menu of things that we actually get asked about a lot in the clinic in terms of maintaining health and whatnot of the population. There's different forms of androgens. There's ones that we use clinically, ones that show up in the gyms, the alkylated ones, which we don't want people to use ever. Prohormones, things that make your body produce more testosterone. Recently on the scene are designer androgens, testosterone-like compounds that unfortunately have found their way into not just professional sports, but locker rooms and gyms. A little bit about growth hormone, what it does, and then talk about other performance-enhancing things. I'm not sure if you can see that at the back, but blood doping and stimulants and metabolic supplements, which is a huge market, people buying things to get themselves healthier. Androgen misuse or abuse was brought home to Canadians with the suspension of Ben Johnson in his career, unfortunately, and we were all saddened when he was found to be using anabolic steroids to win his race, and he was followed here by Carl Lewis, who was quite upset that he was found to be using the steroids, and later we found out that Carl Lewis also was using steroids, but wasn't quite, I guess, as adept at mixing what he was taking, and came in second. So it goes back a long time. Testosterone is not a new hormone. It's been around since 1935, and athletes realized very quickly before the end of the decade of its discovery that it makes you stronger. And it took about 40 years before the IOC decided that it was something that should be regulated and banned from professional sports. And it's gone from professional sports into gyms and high schools. Maybe 3-4% of high school students have been exposed. And somewhere between 50 and 20% of university students had at least once taken a dose of supplemental steroids. So it's part of our society. And there's a lot of, misinformation about what it is and what it does. And hopefully after tonight you'll have a better feel for it. And if you have questions, again, I'd urge you to ask questions afterwards in the question period. So what does testosterone do? Most people have the concept that this is a hormone that makes you grow hair, has a sexual role, and makes you stronger. But it's much more than that. It's a hormone that is affecting the entire body, one way or the other, from your brain function, memory effects, affects your bone marrow, your joints, your kidney, your liver. It does make bones stronger as well as its effects on sexual function and the prostate. So if you have a hormone that has all those effects, and for whatever reason you become deficient in it, you can expect to see a lot of manifestations. And that can run the list here from something that's really not specific, being fatigue, if you will, to weakness, low energy. Men who are low in testosterone tend not to want to go out and do things and interact with their compatriots. The sleep disturbance often, if they've had it for a long time, body hair growth, secondary sexual characteristics, if you will, that the body hair and axillary armpit hair will tend to dwindle, and there is the very significant drop in interest in sex or libido, and some effect on erectile function or erections, and Dr. Brock will talk more about that afterwards. And then effects on mood. Men that are low in testosterone tend to be short-tempered and a little grumpy. Now, for a younger demographic of men, it's not as common to be low in testosterone. We see lots of young men who've lost their testicles for cancer reasons, chemotherapy, or trauma. It's more of an issue as men age, and just as a pure aging phenomenon, your body can can stop producing testosterone, or not produce the right amount. So one of the questions is, and this will maybe come up later in the discussion, is how can I maximize my chance of making testosterone on my own and not require some doctor or care provider to have to give it to me in a medical form. So if a man is low in testosterone and has various symptoms, and we think they're low, it's been shown that if you give testosterone back to those men, you improve or restore sexual function, you improve their mood, energy, you can change body composition, both make the content of calcium in their bones greater and hopefully cause stronger bones, increase their body mass, and decrease body fat. And that's all been proven in studies. So desirable things for men. Now, those compounds, testosterone compounds, get used illicitly again, and there's other stuff out there as well. Androgen steroid precursors, androstenedione hit the news with baseball issues, and it's still available on the internet. We find a lot of patients can get involved in this, and again, we shy against recommending this. We don't suggest they take it. There's probably a bit more of a chance of getting breast development with this supplement, and has the nasty effect of tarring your reputation, in the case of McGuire, blocking your entry to the Baseball Hall of Fame. More recently, and interestingly, there have been groups that have designed testosterone molecules that are meant to elude detection by governing bodies for professional sports. And this goes back almost 10 years now. The first compound was called norbolethone, and laterally tetrahydrogesterone was identified. And maybe in the question periods that come out, this stuff is actually finding its way into Vancouver and gymnasiums and whatnot, and people are making great claims on how you can take this and not get detected with it, and it doesn't have side effects, and some claims such as that which are just not true. Interesting story, it was identified when a coach handed a syringe in to one of the IOC officials, and it took them about a year to be able to test for it, and it led to the tracking down of this character, Victor Conte, who then spent 4 months in prison for distribution of tetrahydrogesterone to professional athletes. And on the other side of the screen is Dwayne Chambers, who unfortunately was the first athlete to get kicked out of professional sports for 2 years for using tetrahydrogesterone. So this can't be read on the small print, but it's a big industry in professional sports. It says these new regulations will fundamentally change the way we get around them. So this is part of life. Professional athletes make huge money winning, and they want to win, and the products get developed because of that, and then they filter their way into locker rooms and gyms and around the world. Growth hormone. Growth hormone's been in the news a lot. This is an old picture from a circus with the midgets, the regular heighted individual, and someone with acromegaly who is excessively tall because of the onset of overproduction of growth hormone before the completion of puberty. In adults who've already finished growing, it does not make you any taller, but it changes your body composition. And that can include improving your muscle development, converting your metabolism a little bit more towards consumption of fat as an energy, and thereby changes body composition. And it's, if you will, from a non-psychiatrist, it's a codependent hormone, if you will, because it doesn't have its full effect without testosterone and vice versa. So the two of them interact to potentiate each other, hence its role. In clinical medicine, a lot of our patients who've had pituitary surgeries and have lost their pituitaries are growth hormone deficient and require growth hormone supplementation. Very common is growth hormone secretagogues. These are compounds that may promote your body's production of growth hormone, and some actually do that. However, a lot of them are amino acids. Amino acids make up protein, and whether or not taking all these very expensive compounds from health food stores to make your body produce growth hormone is any better than eating a high protein meal is an unproven fact, although you can spend a lot of money taking these supplements, and people do as part of their exercise regime. Here we are in professional sports again. Going from left to right along the bottom of the screen is the evolution of Barry Bonds from when he started in his career and looking like normal body habitus to he started just burgeoning here in size. Look at that leg of a forearm there. And interesting statistic, which is available on the internet, after the age of 20 to 25, our heads don't grow at all. That's the size you're going to be for life, unless you're exposed to something like growth hormone. And his baseball cap size has gone from 7.5 to 7.25. So I'm not the IOC, but that sort of needs some explaining. So that is testosterone growth factors. The other way that people potentiate their ability to exercise is to increase the ability to extract oxygen out of your blood. And that can include giving yourself compounds to make your body make more blood, EPO or erythropoietin, or various compounds designed to be like erythropoietin, or giving yourself more blood, either your own blood, which you store in a facility until you need to use it, or actually taking a blood transfusion from somebody else. That's heterologous transfusion as opposed to autologous, which is your own blood. Somewhat more mischievous and a legal way of doing this is training at altitude, and you're fooling your body into producing more blood cells. Or there's a thing called an altitude tent, which is a tent that floods itself with nitrogen, and you're at sea level or wherever you're at, but it makes your body think you're sleeping at altitude and forces your body to make erythropoietin. Now, it doesn't make, in a sense, a dramatic increase in functionality for generic athletes, because it's only about a 2% improvement in your functionality, which you're not going to notice if you're the average guy going to the gym or riding a bike on weekends. But if you're a professional athlete and you've been blood doping or using EPO, you can increase your performance about 2%, which again may not seem like a lot to you, but if you're in a 10,000 kilometer race and you've been taking EPO and the guy next to you hasn't, you're 200 meters ahead of him at the finish line, which is about 40 miles in professional sports. Stimulants are used a lot. Ephedra has been banned because of a tragic death of athletes. It's a horrible picture of a track athlete dropping dead running down the field. We don't want people to take these at all. With the less availability of ephedra, there's been citrus aurantium, which has come out, which is an orange extract, and it's not ephedra, but it is structurally very similar to ephedra and probably has the same risks to people for taking it, and that would include high blood pressure, having seizures, having strokes, having a heart attack, having sudden death, and a bunch of other nasty things I don't think anyone in the audience here would like to have. It's sold the name of Mahuang, or as another name. The last thing I'm going to talk about before I run out of time, there's a whole list of supplements that people will take to try and boost muscle development, and one of them actually that does seem to do something is creatine monohydrate. We really don't know how this works mechanistically, but it seems to help in individuals who are building muscle in bulk, and whether it's purely food for the muscle or whatever. There's similar to the literature, and the last I did about 6 months ago, there was 9 studies that showed it had a beneficial effect, 4 that said it did nothing at all, but the burden of literature suggests that in muscle intensity type sports it has a role. If you're an endurance bike racer, it's probably not something that's going to do anything good for you. I'll stop there.